Hi, Assalamualaikum. Today I'm going to present to you on our campaign, which is I would like to present on our influenza campaign. First of all, we go to a little bit into the introduction of our campaign, which is influenza was chosen as the focus of this campaign because it is a serious public health issue that is often underestimated by the community. Many people assume influenza is the same as the common cold, which causes them to ignore symptoms and delay prevention or treatment. However, influenza can lead to several complications, especially among high-risk groups such as children, the elderly, and individuals with weak immune system. Therefore, this campaign aims to raise awareness, correction misconception, and encourage preventive behavior to reduce the spread of influenza. Next, we go through to our vision and mission. So firstly, we talk about our vision, which is our vision is to a nation where all people, especially high-risk groups, are protected from serious influenza illness. This can be achieved through equitable access to vaccination and sustained public awareness, ensuring that everyone has the knowledge and opportunity to protect themselves. And then we go to our mission, which is our mission is to reduce influenza-related illness, hospitalization, and death in Malaysia. We aim to achieve this by promoting education, prevention strategies, and vaccination uptake, ultimately strengthening public health and reducing the overall burden of influenza in the country.
Next, I will continue with our objective. For knowledge objective, we want to help more Malaysians know that flu can be serious and simple habits like hand washing and masking when sick can protect them as recommended by WHO and other health experts. For belief objective, we want to encourage people to believe that the flu shot is safe, works well, and is an important way to protect themselves and their loved ones in line with global guidance on the behavioral of vaccination. For the last objective, which is behavior objective, it wants to get more people in high-risk groups and healthcare workers to take their yearly flu shot and to stay home, mask up, and wash hands when they have flu symptoms as advised in influenza preparedness and communication guides. So that's all from objective parts. I will pass to our next presenter.
Hi, Assalamualaikum. Now I will explain about influenza versus common cold. Influenza or flu and the common cold are both respiratory illness, but they are different in severity. Influenza usually starts suddenly and is often accompanied by a high fever, severe body aches, and extreme tiredness, making a person feel very weak. A runny or stuffy nose may occur, but is not always present. In contrast, the common cold develops gradually and is generally milder, with symptoms such as a runny or blocked nose, mild cough, and little or no fever. Overall, influenza is more serious and can lead to complications, while the common cold is easier to manage and recover from. Thank you.
Hi, right now we want to talk about how influenza spread. The first thing first is influenza spread through coughing and sneezing. When infected, individuals release droplets and containing the virus into the air. The second is people can get infected by breathing in virus-containing droplets, especially in crowded or poorly ventilated places. Number 3 is direct contact with an infected person, such as handshake or close physical interaction can spread the influenza virus. The last thing is touching contaminated surface like door handle, tables, or phone can transfer the virus to the hand. So, everyone needs to take this way of spreading seriously to prevent it. Remember, prevention is better than cure. So, that's all for me. Now we move to the next presenter.
Now I'm going to tell you the early symptoms if you get infected by influenza virus. It will start with fever and chills, followed by cough and also sore throat, headache, runny or stuffy nose, and you will feel muscle ache, and lastly, feeling fatigue and weakness. If you have those symptoms, I advise you to go to the clinic or hospital nearby for further treatment.
Hi, Assalamualaikum. Today, I will explain the target groups of our influenza awareness campaign. Influenza is a contagious respiratory disease that can affect anyone, but some groups are more vulnerable and at higher risk of serious complications. Therefore, our campaign focuses on these high-risk populations. There are specifically 4 populations that we would like to highlight. First and foremost is young children, which is under 5 years old. Young children under 5 years old are one of the main target groups. Their immune systems are still immature, so their bodies cannot fight infections effectively. Because they often play closely with other children and touch many objects, they can easily catch and spread the influenza virus. If infected, they may experience high fever, breathing difficulties, and complications such as pneumonia. Let's move forward, which is pregnant women. Pregnant women are also an important target group. During pregnancy, hormonal and immune system cause changes that occur in the body. These changes make pregnant women more susceptible to infections, including influenza. Influenza infection during pregnancy can cause severe illness in the mother and may affect the baby, such as premature birth or low birth weight. Therefore, prevention and vaccinations are very important for these groups. On the other hand, seniors aged 65 years and above are another high-risk group. As people age, their body's immune system becomes weaker and resistant to infections decrease. Influenza infections in older adults can lead to serious complications such as pneumonia, hospitalizations, and even death. Hence, seniors need strong protection through vaccinations and good hygiene practices. Next is individuals with chronic illnesses. Individuals with chronic illnesses are also targeted in this campaign. Examples include people with asthma, diabetes, heart disease, kidney disease, and even cancer. These individuals already have weakened health conditions, so influenza can worsen their disease and cause serious complications. Preventing influenza in this group can reduce hospital visits and improve their quality of life. And last but not least, people in crowded or enclosed areas. People living or spending time in crowded or enclosed areas are also key targets in these campaigns. Examples include dormitories, schools, prisons, and nursing homes. In these environments, the influenza virus can spread very easily through coughing, sneezing, and close contacts. Therefore, awareness about hygiene, mask usage, and vaccination is very, very important to prevent outbreaks. In conclusions, influenza is not just a common flu. It can become a serious health threat, especially for vulnerable groups such as young children, pregnant women, seniors, individuals with chronic illnesses, and people living in crowded or enclosed environments such as what had been explained. These groups are more likely to get infected and experience severe complications. Through these campaigns, we aim to increase awareness, encourage vaccinations, and promote good hygiene practices such as hand washings. With that, I would like to pass the presentations to my group member to continue with the next part. Thank you.
Okay, so now we'll continue the presentation. I will explain how we want to avoid getting influenza. So there are 4 different perspectives, which is first one we have parents, seniors, students, and employers and employees. So for the first one is parents. How? Parents will encourage their own family to wear a face mask or use hand sanitizer, especially in high-risk places such as schools and public transport. By by parents encourage their family, this will help in reducing the percentage of people getting influenza. Okay, next one we have seniors or the older people. So as we know that seniors have more low immune, so we will encourage them to receive a yearly influenza vaccination and a booster, as people like them have a low immune due to their age. And other than that, of course we will encourage them to do some checkups, or especially when they have symptoms that related to the influenza. Okay, the third perspective is students. Why students? Because a lot of cases of influenza comes from students, and which to be specific is schools, university. And how actually we want to avoid it is by we encourage students to not sharing their water bottles of food with their friends, especially with the friends that have symptoms like colds, like having a flu. And we can use the teacher also to encourage the students to keep the classroom clean and well ventilated, so that the flu does not keep in the classroom. Okay, for the last side, which is employees and employees, how we will use them to avoid the influenza is by employers. They should provide a face mask and sanitizers to workers. So if the workers are having flu during the work, they can use it. And then for the employee side, if they are feeling unwell, please just stay at home getting an MC, so that they will not come to work, because if they still come to work, it will help to spread the influenza or any diseases. So we should encourage them just between employees and employees to keep supporting each other in terms of getting the influenza far from everyone.